your mentee. Hello? Where's Omobowale? Omobowale, introduce your mentee. Okay, Ata, introduce her. You have her brief resume. Introduce her. Dr. Ata, Professor Omobowale, we're online already. Okay, Funke, unmute yourself and introduce yourself a bit. Don't worry. They are too afraid of you. Okay, you cannot introduce yourself and then you start.
Okay. Thank you so much for this opportunity. I don't take it for granted. So my name is Adebayo Olufunke. I'm a graduate of Adebayo University, Zaria, and I'm so proud to be an alumnus of that school. And so currently, I'm at the Veterinary Teaching Hospital, Federal University of Agriculture, Abeokuta, where I am I'm a head of units for our annex station, which is at Keita Ijaba, Abeokuta. So I love veterinary medicine and I love clinical practice because I love to put smiles on people's faces. You know, when they walk into the clinic sad about their pets and they're going back happier, that's what brings me joy. So I'm very passionate about veterinary practice. I don't take it for granted. So I think this is just a little summary. And I'm married to a vet. He's a professor of veterinary anatomy. So together we are at the Federal University of Agriculture, Abeokuta. So that's about all. So thank you so much for having me here, Blue Bat TV. So can I head on into the lecture now, sir?
Yeah, straight on.
All right. So the topic before us today is leptospirosis. So just give me a minute. Let me share my slide. And I'm very passionate about this topic. You know, when Doc gave me the opportunity and told me I'll be sharing this, I was so happy because I know that this is one disease that we ought to be talking about. So leptospirosis is what is before us today. And briefly, I'll just look at what leptospirosis is. It's a zoonotic disease. This is a very important way to start. Please, am I audible enough and can you see my slides?
Yeah, yes, we'll see your
All right.
slide.
So leptospirosis is a zoonotic disease, and that shows that all hands must be on deck when we talk about zoonosis. It affects humans and animals alike. It's also called lepto for short, and it affects all ages, breed, and sex. It's a spirochete, and it's caused by Leptospira bacteria, and it has many serovas, ranging for what you call species or subspecies in some other diseases. So it has serovas ranging from Canicola to Pomona and so on and so forth. So one major problem with leptospirosis is that it causes serious kidney and liver damage in the affected animals. And then another irony about this infection or this bacteria is that it can survive in water and soil for weeks, going to months. So it's very important we know more about this disease. It affects cats and it affects their liver, their kidney, even their reproductive system. And also, you know, it affects dogs too, and even livestock. It has phases in the infection. We call one the septicemic phase, and another is called the immune phase, and there is also the carrier phase. So as we go on, we will get to understand more of this disease. There are forms of the leptospirosis. So for aid of simplicity, because this lecture is all about making the lecture simple. It's not an inaugural lecture, so we'll make it as simple as possible. I've come up with some forms of the leptospirosis. Yes, so we have some forms, which is musculoskeletal form. In this musculoskeletal form, in the affected host, it causes pain and tenderness of the muscles. The animal is reluctant to stand. And we also have the gastrointestinal form, which causes vomiting and diarrhea in the affected animal. It could also result into respiratory disease. In such cases, you see signs of pneumonia in the affected patient. Then I call one the multiple organ dysfunction complication, where it affects the kidney and the liver majorly. Then, of course, you have the carrier phase. These are asymptomatic animals, and they just keep shedding the disease in the environment, and this asymptomatic animals cause a lot of harm even to humans and animals alike. I just got this from AMC, and I thought to share, where it talks about the cycle that leptospirosis goes through in dogs, and it has affects multiple species, with rodents really incriminated. And you see that when a dog is infected in this particular slide, the dogs could drink from water bodies or puddles, and if it's infected maybe by a rat, and then the dog gets infected, and then treatment is the key. Early treatment is the key. Early diagnosis and treatment, actually, before it gets to a multiple organ dysfunction level. Then vaccination is the key. Prevention is the key. So I'll just go on to the next slide. Talking about the mode of transmission properly now. So in dogs, you have it's been transmitted to dogs when there is a cut or there's an abrasive wound on the dogs, or via mucous membrane, the eyes, the nose, and the mouth, or you have dogs drinking contaminated water. It could also be transmitted via placental transmission from the dam to the puppies, or from the dam to the kittens. Then you have in humans. It's important to talk about humans too, because if it's a zoonotic disease, then it's something we have to be very careful about, especially veterinarians, that we could be exposed to occupational hazards from this particular disease. So in humans, it could be transmitted to them through contact with infected urine or urine of infected animals, such as rats, dogs, and livestock, especially when there's a contaminated water and soil. Risk factors, yes, top on the list are veterinarians, because some of these animals, they shed this disease and they come to our clinics asymptomatically. So how do we prevent ourselves from this risk of a zoonotic disease? So I decided to highlight the risk factors so that we could know that these are more sources of exposure. And when we have people, maybe we have people here that love to swim a lot. So swimming in contaminated pools or water, dogs and animals alike, could lead to getting this infection. Then there's outdoor sports, which we call mud runs. We run on the mud, and I tried to put a picture down there. And if such mud is contaminated, then the humans having that kind of sport are actually exposed. Then farming could
he's
also lead to a source of risk. Yeah, could also predispose.
You're breaking a bit. So check your data. You're breaking.
Humans and animals alike too. Yeah, please. Am I still audible? So when we have, all right. So contaminated water or puddles are also sources of infection. So let me go to the next slide, which talks about the clinical signs. So clinical signs in dogs range from lethargy. You see the dog comes in very tired and lethargic, not having any iota of strength. we call something polydipsia. The dog wants to drink lots of water, and as it's drinking the water, it's vomiting and is having diarrhea. Is anorexic, doesn't want to eat at all. There's weight loss, there's fever. One major thing I want us to note is the jaundice, because I'm sure there'll be questions later on that. So how do we really pinpoint this type of disease? And since we have seen it one or two times, not really, more than one or two times, several times at the hospital. So one major thing we want to look out for is jaundice, vomiting, and lethargy. So amongst others, we have bleeding disorders, epistaxis, melena, and emetmesis in such animals. In cats, we have depression, nasal discharges, weakness, cough, and inability to urinate, anorexia, vomiting, diarrhea, and so on and so forth. It also affects the reproductive organs of the females, causing vaginal discharges in the females and subsequently difficulty in breathing. In ruminants, I deliberately mentioned this so that we know that they are also affected. We have abortions, weakened offsprings, and blood-tinged milk in lactating animals. Humans, it's called Wales disease, and it presents with flu-like symptoms, and there's liver or acute kidney injury. There's abdominal pain, nausea, vomiting, diarrhea, jaundice, and chills, and amongst others. Okay, we talked about 7. Okay, so we're going to 8 now. So diagnosis. One major, the way in which we do the diagnosis at the Federal University of Agriculture at Abeokuta is dark field microscopy. At the pathology lab, we have this form of diagnosis. We have this method of diagnosis, and it has helped us over time to be able to isolate when an animal is coming in with leptospirosis. So what we do is that we send the urine sample to the lab, urine sample of the affected animal to the lab, and then they're exposed to the dark field microscopy. And when we see the spirochetes in the dark field, then we know that we are dealing with leptospirosis. So this picture is from Khan et al., and I just thought to share, looking at a very lethargic animal and jaundice, and at postmortem we see the severe liver damage that's been done to this animal. And so we go to further diagnosis. Basically, we want to go with history. History is very important. Oh, my dog has been vomiting and passing diarrhea. Oh, I noticed that the body is just yellowish. So you want to really isolate and say, okay, this must be leptospirosis. There are other things that could cause jaundice, but one major thing that should come to our mind when there's vomiting, diarrhea, and jaundice is leptospirosis. And then you want to do a clinical exam. So on clinical examination, you are seeing jaundice, you are seeing lethargy, you are seeing that the animal is dehydrated because of vomiting and diarrhea. That should be a sign that, okay, this is what most likely I'm dealing with. Then we go further for diagnostic testing, which is the dark field microscopy that I talked about. But I know that it's not everyone that has access to a dark field microscopy, not to talk of microscopic agglutination test. I've not even done that. And cage side tests, PCR, that's going too far. It's going to be very expensive. So how much are we going to charge the clients when we say, okay, we need to do PCR? So we don't even go there. So based on history and clinical examination, this will go a whole lot, give us a whole lot of help to be able to, at least to an extent, come to the point of diagnosing this particular ailment. Then radiography could help us, but there are other forms of infection that could cause pneumonia. So it's neither here nor there. So, but if the client really wants to do further investigation, you could do an X-ray, chest X-ray, then check if there are signs of pneumonia in the affected animal. Abdominal scan, I love doing abdominal scan, but it's not only leptospirosis that could give a change in liver or kidney echogenicity. So it's neither here nor there too. So what are we left with? If you have to do serum biochemistry, you take the blood and you send it to the lab for alkaline phosphatase, ALT, bilirubin. There are other liver conditions. For example, babesiosis, if you have a pre-hepatic jaundice. So it will give you some of this serum biochemistry increases. So where do we go from here? If you do complete blood count, you can have mild to moderate thrombocytopenia. Okay, that may not really be of a help. So it's neither here nor there. So that's why I'll just stick to history and clinical examination, thorough clinical examination for us to isolate this disease. And before I go to treatment, most oftentimes we have clients who present their dogs with incomplete vaccination. So this is one of the things that should help us to pinpoint whether we are dealing with this. But we know that currently, because of the vaccine storage, we are having pockets of vaccine breaks or failure. So even with complete vaccination, we may not be able to roll out leptospirosis. So when we're talking about treatment, we have to ensure that there is a barrier nursing. Barrier nursing, we have to put on PPEs, protective gloves, coats, and nose mask. It's very important. And this particular dog should be placed in the intensive care unit, because we do not want this infection to be spread from this dog to another dog. So if it is leptospirosis, we want to do a barrier nursing. And what we do with barrier nursing is that the particular doctor that is handling this particular case will be the one that will be stationed to handle this particular case. Oftentimes, maybe maximum of 2 people. You don't want to have too many doctors handling this case and adding other cases, so that you don't spread through fomites. And then we want to do, because of vomiting and diarrhea, we want to do IV fluids. So we want to do Ringer's lactate, normal saline, dextrosaline. This will help a lethargic dog, anorexic or vomiting and diarrheic dogs. And so you want to, first of all, check the percentage dehydration so that you can be able to calculate effectively how much to replace the ongoing losses. So you could check through skin tint whether the dehydration is less than 5% or getting to about 10% or more. And so with that calculation, then you now go on to using the 40 to 60 ml per kg per day to do your maintenance dose of IV fluids. Very important. Mainstay of this battling this infection is actually IV fluids. You want to stabilize the dog or the cat, so that you can replace ongoing losses. So symptomatic treatment, because it's vomiting, it's having diarrhea, it's having pockets of pneumonia, so you want to give antiemetics. Right now, we do not do so much of metoclopramide, but most people are used to antiemetic. Oh, metoclopramide. Now we do ondansetron, because we see that it's very effective, to help with the emesis. So we give them at those doses, dogs and cats, and you may want to do omeprazole. It helps too. And then for the diarrhea, we give iocin. And then you could do light kaolin, especially when the vomiting has stopped, or you can give that for us. Then for antibiotics, majorly we do doxycycline in dogs. And then, but what do you now do if the dog is still vomiting and you have to do doxycycline? Doxycycline injectable is not a common stay. So what you want to do is you want to give penicillins injectables, or you want to come in with penicillin streptomycin at the appropriate doses. Some have advocated ceftriaxone. You could go with that, or enrofloxacin. But most times you don't want to go first with enrofloxacin, because it's not good to be administered to young growing dogs, because it affects the bones and formation and cartilages. So you don't want to do Aeroflux. And so ceftriaxone, you do that at those appropriate doses. Then next, prevention. Prevention is the mainstay of this infection. So we want to ensure that adequate vaccination is given to these animals. We want to ensure that there's use of protective equipments, PPEs, and then rodent control, because rodents, rats have been highly incriminated. So we want to ensure that there's good rodent control, and then there's stricter biosecurity measures in our swimming pools and other areas where we find ourselves or we keep these animals. We want to use disinfectants, and we want to, have the culture of hand washing. And I had to look at the role of rodents in leptospirosis and Lassa fever. Why I did this is because rats are incriminated, and I needed to tease out the fact that they are not the same, even though they may have the same vector causing that ailment. So for leptospirosis, it's a bacterial disease. Lassa fever is viral. And then the primary reservoir for leptospirosis are rats, wildlife, and cattle, whereas in Lassa fever, it's just rats. Then we have transmission in leptospirosis is through urine, contaminated water, or soil. And for Lassa fever, it's urine, fecal materials, and contaminated food or dust. They are both zoonotic. While leptospirosis is highly fatal in dogs, Lassa fever is highly fatal in humans. And then these are my selected references, and I sincerely want to appreciate everyone for listening, and I want to welcome any addition, any question, and any form of further information. Thank you so much, Dr. Charles Ibe. I'm so grateful.
Yeah, thank you. Thank you very much. This is a well-coded, well-worded lecture on the platform of intellect. Yeah, my sister, you're a person of high intellect. Despite the high cost of fuel, the high cost of living, we're able to think out. That means you're instant in seasons and out of seasons. Continue on that platform. Beyond the sky will be even beyond the sky to heaven will be your limit. Thank you very, very much. And then Omobowale, before we get back to, I want you to chip in some words here. Omobowale, where is
thank you.
Yeah, I want you to chip in some words here. Just give her a corrigendum. Something looks like an addendum. Then we'll move on.
Yeah, thank you. Thank you very much, sir. Yeah, it's a very good topic for this time. Leptospirosis, as we all know, is the most widespread zoonosis. And this disease mimics several diseases because of the multi-organ tropism that the disease has. And what that means is that sometimes the clinical signs could appear as GIT infection, liver disease, renal failure, respiratory disease, sometimes even neurological dysfunction. So several times clinically, it is difficult to really know whether it's leptospirosis or any other thing when the disease sets in. So it's a very good topic for this time. But something I really want to say is that the presenter mentioned the use of dark field microscopy. Yes, yeah, that's one of the diagnostic tools. But the MAT titer, microagglutination titer, is the gold standard for knowing clinical leptospirosis. There are animals that could be carriers shedding the bacteria. Meanwhile, they are not clinically sick. So in such animals, maybe they have other diseases affecting them and they are carrying leptospirosis. They could be shedding the bacteria in the urine, and the dark field microscopy will pick a positive. Meanwhile, the animal is being affected by another disease entirely. So there could be a kind of confusion there. Unfortunately, microagglutination titer is not something we have access to the reagents to carry out readily in Nigeria. So we still have to rely on clinical science and other means of trying to diagnose it. By and large, I want to commend the presenter. That was a very, very well researched and presented, topic. Thank you very much, Dr. Adebayo.
Yeah, I have a double canon question for. I have a double canon question. Please, still unmute yourself, Adebayo, and unmute yourself, Mopowale, because we are going to fire you with questions right now. We are at the merciless period. We have 4 strengths of which you didn't mention, which I believe we have 4 strengths of leptospirosis. Have we typed the one in Nigeria? Vis-a-vis the vaccines we should be bringing. Has that been typed? Because you have grypotyphosa and you have vaccine for pulmonary or epidemic hemorrhagia. So has it been typed? Or if it is not typed, do we bring in the vaccine that contains the 4 strains to be on the side of history and common sense? The question, you answer it one after the other, Ma. Please.
All right. You want me to go first or you want my Oga to go first?
According to you, the way your Oga and you can do it. But I think you should go first, yes.
Okay. Talking about typing leptospirosis, work has been ongoing in Nigeria in leptospirosis. At least I know that one of my ogas here at the Federal University of Agriculture is very passionate, Professor Ajayi, who is our current dean, is very passionate about leptospirosis. And work has been going on and is still ongoing. But, it's the same thing with parvoviral enteritis. Work has been ongoing and is still ongoing in Nigeria. These strains of leptospirosis, which ranges from pulmonary to ectohemorrhagia, and the rest. Such strains, I'm not sure the particular one which is found in Nigeria. I was just trying to check which one is found, is embedded in our vaccine. But I think one of the major things, what we're bringing to fore today, is to see how we can have more researches in these areas, especially diseases that are zoonotic, like leptospirosis. I have not personally worked on or researched on leptospirosis, but I know my Oga will have more details on that, on the leptospirosis. But I know that work is ongoing, but we have not gotten to a point where we can say that enough work has been done to be able to combat leptospirosis in Nigeria.
Yeah, Omobowale, do you have an addendum? Omobowale?
Yeah. Yeah, she already said it all. I know Professor Ajayi worked on leptospirosis for his PhD. Then much earlier, before then, late Dr. Agunloye from the University of Ibadan worked extensively on leptospirosis. But I'm not aware of current studies on leptospirosis in dogs up to the molecular level that will tell us the specific serovars we have, and maybe there are mutations in what we have compared to what we know before now. So that's why we are calling on government, and we are calling on entrepreneurs like Dr. Ibe of Bluebird International Limited. Fund researches. I mean, it will not be a bad idea for you to fund a study on leptospirosis in Nigerian dogs at the PhD level, and you'll be acknowledged for it. And also, many people bringing vaccines into Nigeria. These are things that can be done. You see, when we talk about people who do research on these diseases in Nigeria, many of them use their personal funds. And there is only, with funding from corporate organizations and from government, I can tell you, we have the expertise to do all these things you are asking for. So
Are you aware that there are a lot of international funds? Because I'm a member of the World Veterinary
How many
Program.
of
I am coming. Don't. Are you
many
aware?
of them want to fund Nigerians?
No, you see, how many of you are connected to these international organizations in terms of attending their international conferences, presenting seminars, presenting research work, even if at poster presentation, and then calling for the people involved to assist you to do these things? Because I remember when, I think in Denver, Colorado, I asked one question. No, in Egypt, Cairo in Egypt. I asked one question at the plenary session. Some researchers came to me, can we do one or two things together? Including one show and bishop and under teapot. But unfortunately, I told them, I'm sorry I asked these questions out of inquisitiveness, that I am a trader, a self-confessed trader. I can't leave my trading. So all I advise you people that anywhere you have an international organization tending towards research, belong to that, attend their conferences, make your presentations, ask them this is the area you want to go, look out for the funders, and then you are good to go. That's how my uncle, Omobowale, you know him, Professor Obi. Unmute yourself, Adebayo. That's why
Yes, sir.
Professor.
We have the privilege to have my dean, Professor Ajayi, who has extensively worked on leptospirosis. He's here presently, sir.
Okay. Professor Ajayi, do you have our question or do I go back?
Yeah, no problem, sir. I've had the question. Okay, good morning, sir. How's everything, sir?
Cool. Remember what I promised you in FUNAB?
Yes.
Anytime I'm in the country, you have it, call me, I'll come.
All right.
Okay.
All right. Thank you so much, sir. Now, Dr. Adebayo, thank you so much for having me also. And I will say that a lot of work has been done in typing some of the cerebrals we have in our country here, especially in the Southwest. Now, I did this for my PhD work, and cerebral like hemorrhagia, Canicola, Bratislava, and Hajo. I think about 6 of them, but there are other, times which I've not been able to, to lay my hands on because I use math at that time. Now, there is a particular one which I'm involved in now, which we likely use PCR to advance some of the cerebral we have in the environment to type them. That is what we are planning to do. But at least I've been able to, identify nothing less than 8 of these cerebral in our environment. There are the one which I've not done at all on type 1 in the country, but there are many, especially in our dogs. Even in the Southwest now, I can bet it with you, you can hardly see a dog where they have rat in that hole where you won't see leptospirosis. Especially our local dogs that move from one place to the other. You will find different types. They are there all the time. You can caution it out. I caution a lot of them. These are the things which I've done, in the few years back. Thank you so much.
Ajayi, Professor
Yes,
Ajayi,
yes,
are you talking about the main cerebral or subcerebral?
The main cerebral, sir.
The main cerebral. That means you are in problem because what we know is 4, and now you're talking about 8.
No, we are talking about.
Did they cross react?
No, I didn't, but the one I actually typed, hemorrhagia, Bratislava, Canicola, Hajo, and especially in rat. In rat, you find a lot of hemorrhagia, and this is so common in our dog.
Yes.
It becomes serious. And even there are times that you will find it in the blood if they can come at acute phase. They bring such a dog to the clinic. They take the blood sample and just look at the dark feed. You are going to see the spirocate within the blood. It's so easy to identify. Moving and rolling, see them. And these are the things that is so common here. And most of the cases we have, jaundice and all that, is as a result of this leptospirosis.
No, is it dictatorial hemorrhagia or pulmonary or grypotyphosa or what?
It's common. It's so common.
Okay.
Though we have other cerebrals in dog, but the most important one is the hemorrhagia, where you have a lot of jaundice.
Okay. Thank you very much. I think you see, in seminars or intellectual talks like this, all we do is most of the things we do is to bring up some teasers for further research. To teasers for further research. I mean, research is a continuum. It's a continuous process. So what we do in this kind of situation, in this kind of talk, is to generate topics or push minds to generate topics. Okay, because if we generate topics for you, it might not flow on international platform, on intellectual or research platform. But we will open your mind to further research. That's why we are here. And when people like us in the field, when we talk in a platform like this, we are talking from what we have seen in the field, and it is confusing us. It is you, the people in the research world, that will tell you, where I will clear those clouds, those confusion. I thank you very much. I think we're having some healthy discussion on this topic. Now, coming to okay.
Let me chip in this up. Now, if you look at the cases of renal failure, is becoming alarming. I've been to some hospital to ask them whether they've heard about that disease. I've seen a lot of doctors that they've never saw one case since he started practicing. Now we want to know from the urines of some of these people having renal failure, can we collect urine, to examine whether we can find out some of these organisms? Because almost in every home you find rats. That's another area we're also looking into, sir.
Thank you very much. It shows that there's a disconnect between the research world and the clinical world. Apart from the clinical world in the teaching hospitals. So those classical disconnects, how do you bridge it to have a connect? That means you work in tandem with forms, with all manner of things all the clinics. You've seen this, have you seen this? Which you are just trying to infer. Why not try this? Why not give us this sample to analyze for you? If you have case of kidney failure or what like jaundice, because jaundice, there are many causes of jaundice. You have the obstructive jaundice. You have the one in hepatic jaundice, the one which is, I believe, ictal hemorrhagia is causing. You have a hemolytic jaundice. There are many types of jaundice. So it's not any time you have jaundice. But sister has said jaundice with vomiting, with this, you'll be able to be clicking and queuing together. Anyway, thank you very much. Another question I have is on treatment. Is on treatment. You see, what I believe, I know that the spirochetes are very difficult to culture. To be able to get a call, I don't know how many media that they can accept to grow in, because of the way they are coiled nature. You have a bacteria in order, like swine dysentery, treponema, there's syphilis in human beings. These are all spirochetes, and they're very pleomorphic in their morphology. But I don't know because what separates us with the quacks? What separates us with the quacks? Quacks will come and give you this injection, anyone that is working will work, anyone that is not working will not work. But we all try for even cost-benefit analysis in our practices. We all try to key into what will work. And then being tangential, the drugs we give. What are the best drugs you can give? If you have diagnosed or you have diagnosis of leptospirosis, what is in the country today? And then the regimen, the treatment regimen. You mentioned pen strep. Pen strep, any quack can get pen strep and shoot. The dosage he does not know. The regimen period he does not know, or she does not know. Let me be gender sensitive in this case. So how do we tackle the treatment down to professional level, clinical professional level, and get an efficiency? Then please, at this spot, you can raise your electronic hand to ask questions, please. Or make some comments. It is open. It's open now. And the people, I'm in the chat section, people are commending you. Make sure your husband will cook for you today.
Yes, sir. Yes, sir. So
Okay.
you mentioned the treatment. Yes, I try to put that in the presentation too. If you're talking about which way to go for the treatment, which is also cost effective. Yes, I like the fact that you said that pen strep is so common and everyone can just do whatever they want with it. But the fact is that it's still working. It's still a very good antibiotic, because what we want to do is that as vets too, we want to be AMR compliant. We don't want to abuse or cause, resistance of these antimicrobials. So what we want to do is that we want to start from the least before we go to the top. So that's why most times we make penicillin streptomycin our mainstay. It's affordable once we are able to go with. So most times what we do is that when we get the pen strep, you want to look at the manufacturer's instructions. Most times they tell you that 1 ml to 25 kg. So most times you just want to go with what the manufacturer is instructing you to do. Take appropriate weight of the animals and then you treat accordingly. But like I said, when vomiting is no longer experienced in the animal, doxycycline is very good, because doxycycline will also take care of the renal carrier phase. So doxycycline coming with 5 milligram per kg per os. You can do up to 10 milligram per kg. If it's 5 milligram per kg, you can do BID twice a day. Most times, if you're coming in with doxycycline, you may treat for as long as 7 to 14 days. Then, if you're doing 10 milligram per kg of the doxycycline, you can just do once daily for as long as 7 to 14 days. And then, if
You're breaking. Yeah, Omobowale, can you continue from where she stopped?
We are having a problem.
Okay, she has started.
Some dogs react to doxycycline, especially because they are not aware of their kidney status. So most times you can come in with ceftriaxone. Ceftriaxone injectables, either IV or IM, at 25 to 50 milligram per kg is fine. So once we are able to do that, at least for the first 5 days with ceftriaxone, we are fine. Then we can now dispense or administer the doxycycline to take care of the renal carrier phase. So basically, I would do this antibiotics, ceftriaxone, doxycycline, and then for kidney problems or liver problems, I didn't put it on the slide, but we do some liver medications like silymarin. Silymarin has been proven to be very good in liver cases. So if you have to buy a pack of 70 milligram silymarin, I think that's about 2,000 plus, 2,500 or thereabout. So, and what we do with silymarin is we give the 70 milligram. You can either give it once a day or twice a day. So you can do either SID or BID. You can do for as much as 7 to 14 days. That's the liver tablet. That's silymarin. You can come in with hematinics, the cheapest being folic acid, especially when you have bleeding disorders. So you can come with folic acid. Folic acid, 5 milligram per kg, 5 milligram of the tablet once a day for 2 weeks is fine. Or if you don't want to do folic acid, you can do B12 injection. If you don't want to do B12 injection, we have introduced Jobelin. I also worked on Jobelin. Jobelin is a very good, potent anti-hemorrhagic. It's also anti-inflammatory. It's used by sickle cell patients. And so we've adapted it for our dogs. Where we have an anemic crisis in the dogs, we do Jobelin. Jobelin, as at the last time I purchased, I think a sachet of 10 capsules of Jobelin is about, it's less than 1,000 naira. It's less than 1,000 naira. So these are a combination of drugs that we could use. The antiemetics, I've mentioned them already. If you like the metoclopramide, you can do your metoclopramide. If you want to do omeprazole, ondansetron, you can do that accordingly. So it depends on affordability, availability, and then how much are you charging the clients? Very important. So if the client is not able to afford because the whole course of medication may take close to 2 weeks or more. And then so you look at how much the owner is able to afford, then these drugs have their different ranges of prices that you can work with, since we have a variety of drugs that can be used.
Anyway, there are some good, I will call it economic owners of these pets that can pay you any amount so far as do the best work for them. They are the moderate ones. There are some of the lower ones that cannot even pay what you're doing. Those ones will refer them to public hospitals, unless you are doing a pro bono job, which does not pay you with the economic situation in the country. We advise pro bono, but we don't advise it to extreme, because the economic situation in the country does not support it. Your landlord is not telling you whether you are doing and asking you whether you're doing pro bono job or whatever. All he wants is his money. The fuel person selling fuel will just is pay as he's giving you fuel. It's not asking you pro bono. So we look at the economic situation of the person involved. Some of them are good, like those in VI, those in Lekki, those in Asokoro, those in the oil magnet in Port Harcourt. You see, those ones don't care. You sit down and do good job because you want them to come back again. Anyway, thank you very much. Somebody is saying, thank you, Ma, for this wonderful presentation. For this media using urine culture, EMJH, and Fletcher's media are best, but they are not commercially available here, except one import the media, which is cost effective. That's the media that can culture the leptospirosis is talking about. Thank you, Oraku Ogechukwu. It looks like you are knee deep in canine medicine. Well, whatever be the situation, to have your best practice. You see, most times these days we don't rely on government to give us some of these, because government, they have their own lacuna, they have their own problem, they have their own hiccups. You can set up your own lab by yourself and do the best to get it. And you can see that the epidemic of leptospirosis is high at clinical, subclinical, and non-clinical levels. And we need to do a lot to help your practice. Thank you, and I wish you the best. So whoever wants to ask questions, can ask questions, you can raise your hand. You can raise your hand, you can ask questions. And don't spare her. Don't spare her. We are here to bombard her. Anyone she doesn't know, she can research and get us more results. That's why we are here. Where life is ad infinitum. That's what life is. It's a continuous process. Professor Ajayi, are you still here? Has it crashed out? Professor Ajayi has crashed out. Okay, any question, please, so that we can round up this session. Do you have any question? We have catalogs of people here, many of them. I have Linda Shagwa here, our former treasurer of the. We have Rojo Vets. Omobowale is always reincarnating as Mopsy. Don't know where he picked that. That is in the church, where he's playing organ. That one. Because he's an all-rounder. Grace, Kia, how are you? Please, you can, Maxwell, Chiloka. Anyway, any of you can ask questions in the next 15 minutes, so we can. Okay, I love you too, Grace, Kia. So please, don't spare this woman, no. Bombard her. This is not classroom for undergraduates, where they are telling
there is nothing to bombard her with, because she has done an excellent job. And I think we should commend her, like I'm doing right now. Dr. Adebayo, thank you very much. That was a beautiful presentation. But I just want to add to, I just want to add to what you said concerning the treatment. As much as possible, we want to avoid nephrotoxic drugs while treating leptospirosis, because we know that leptospirosis can lead to renal failure. So as much as possible, we want to avoid drugs that are nephrotoxic. So At the University of Ibadan, we don't use pen strept because of the streptomycin, which is known to be nephrotoxic. It can complicate the situation if the animal presented is already showing renal failure. So we rather use any of the other penicillins like amoxicillin, penicillin G. We avoid any aminoglycoside, penicillin, streptomycin, gentamicin, amikacin, or any other aminoglycoside. And like you said, after we treat for 7 days with a penicillin to eliminate the organism in the blood, we also follow up for 2 weeks with doxycycline to eliminate the renal carrier phase. So our protocol also aligns with yours. The only thing is that we do not use any nephrotoxic drug.
Yeah. How about using ampicillin and clozacillin? Now, beta-lactam. There are higher beta-lactam group of drugs. That's the penicillin group of drugs. Those are at the higher level. If the client can afford it.
Yeah, the ampiclox, that's ampicillin and cloxacillin. Cloxacillin is not known to be nephrotoxic, but I can tell you that amoxicillin works excellently. Works excellently without even any combination. So we also have to consider economics. So if the drug as a single agent works effectively, there is no point combining any other thing with it. So far, the penicillins work excellently.
That's a beta-lactam group of drugs. But do you have the phases of work among them? Because there are a lot of drugs in the beta-lactam group.
Well, we only use amoxicillin.
Okay, good.
Of course, there are several penicillins, but amoxicillin works. So we don't bother looking for others. And it's readily available. So
yes. Okay. Somebody is talking about rapid test kits. Can it be of a good help? Maxwell or Nyimba. Can it be of good help? Unmute yourself. Why are you pushing your hand the mute? Unmute yourself. Please.
Well, let me share my own personal experience with the available rapid test kits. We once got a rapid test kit in our practice in Ibadan at the veterinary teaching hospital for the I can't really vouch for the quality of that kit. I can't really vouch for the quality. I mean, it's we used it several times when we suspected leptospirosis and it came out negative. So it's one of two things. It's either that we have a lot of cases we suspect are leptospirosis, which are not actually leptospirosis, or the rapid test kits that we use are not working very well. Unlike power test kits that we have, those ones work very, very well. They work very well. But for the commercial test kits, leptospirosis test kits that we got some time ago, it didn't really work well. It did not really work well. So I don't want to talk much about the reliability of those commercial immunochromatographic test kits. I don't want to talk much about them because I've not had a good experience with them.
Yeah.
Well, maybe others have, other people who have had good experiences with them, maybe they can share their experiences here.
Yeah, we are here on a mental storm, a brainstorm. Whatever you have, please offload it now to teach us. That's why we are gathering ourselves together. We need to be taught, because if we are not taught, we'll be messing up. That is what separates us from the quacks: continuous learning, continuous improvement. That's the idea. Continuous improvement. Kaizen concept that made Japan what it is today after the Second World War. They said they must continue to improve. That's why this version of their vehicle, when they started, others are taking this year version, the next year version will be better. They continue producing better version of the same vehicle. And that is not only in vehicle, in all their life culture, in their life concept. Continuous improvement is the key this time. If you are not under continuous improvement, you are under stagnancy. And stagnancy is not a way to life. We need update. And one thing I will tell Adebayo, we are going to do feline, because what we have found out now, we have eruption in our case study, because we go about intelligence in the cases we are having in this country. There is an upsurge in the use of cats, ownership of cats in the country today. But it looks like we are not managing them well. There are I think that our colleagues are managing them like dogs, and they're coming up with kidney failure. Thank God renal failure came up in this topic. And the next we're going to deal with it squarely. We have gotten a resource person from FUNAB who is going to deal. I think she is here. Yeah, we are looking for somebody that will moderate the person, and then we go on and deal with feline medicine. That is animal in the feline family, the felidae. The cat, the big cat, the pussy cat, what else, silver cat, they have the same, what do you call it? They have the same liver biochemistry in terms of managing drugs and managing foreign items in the liver. Oh, I don't want to open up because I'm a novice in that. She will come and deal with it squarely. So please, the more you continue, anyway, we try to reticulate our knowledge and all these topics and discussions in the YouTube so that you can go and have and refresh your minds on it. So I'm seeing a lot of those in small animal medicine here, and I know they are getting a lot. They've not gone. We have increased from 10, 8 now to 25, which means that today we have a sweet topic. And next, we'll continue to have sweeter topics. And then Adebayo will be here with us. I think you are the one that discussed blood transfusion with us.
Yes, sir. We got on it somehow, yes, sir.
Yes, we got on it. Do you have more? Do you have to improve on it? Because life is a continuous improvement.
Yes, yes. And I love what you said about the cats, just to chip in. Yes, indeed, we found out that we have more owners, more ownership of cats in the recent time. In fact, just 2 days ago, I was telling my husband that I need to go on a study on cats. I need to, so sir, in case you have training grounds for cats, it's an area that we really need to delve in as vets so that we can treat them appropriately. They are fragile, they are complex, and we need to give them the best shot since we have more people that are responsible cat owners. Yes, sir.
Our colleagues are managing them like dogs, and their kidneys are failing. Let me just say the truth here. So, Grace, Kia, I know on gender sensitiveness, you will praise her. Don't worry. Don't worry. We know. I said the presenter is doing a good job. That is Grace, your gender colleague, is saying. So we will analyze this statement and see whether it's, I don't know, whether it's sensitive or non-sensitive. Whether it's sensitive or non-sensitive. So that's it. We are coming up with some hot topics. We deal with cats 1 or 2, 3 times, because please do your research, because we are calling you back into it. You know, when you have an eruption of a new area that needs a new strategy, there must be a work that will be able to update the strategy. Because you cannot use old strategy. You know, there's something we said. You cannot use yesterday's strategy to help you to advance tomorrow. You will fail. And that's where continuous improvement comes in. What brings you here cannot take you there. So on that concept that what brings you here cannot take you there, we'll continue to study. As far as human being is concerned, we must look, listen, and learn what surrounds us. The 3L, I call it the 3L in my discussion. So please, if we don't have anything to discuss, some people are making some statement. Let me see, there are 2 more. Okay, that's Grace Kia. You have a sweet person as a presenter, sir. Okay, as I was to say, thank you, ma, you for this wonderful opportunity. Okay, silver cat not fairly. You say what? Silver cat, are they not fairly there? Maybe. Okay, okay. Omobawale, can you please? I'm an inquisitive person. What's it? What silver cats? What family do they belong to? Omobawale. Unmute yourself. You muted yourself. Maybe you have a new family that has just emerged in the last 10 years. I don't know. Okay, it's in the CV. Ben or not just say it's in the CV there. Okay. I'll look at it again. So whatever be the case, the cat family will deal with the cat family. We might even check whether the CV day and the Feli day, they share some common biochemistry. We'll look at it. But that's all. Thank you very much. The family of CVD. Thank you for being corrected. That's why I like myself. I always push some thoughts that will retort my thought. Thank you very much. Funke Adebayo, please, you are a host. Stop muting yourself. Are you dodgy? Do you want to be dodgy? Yeah? Yeah, about what? You know one thing. If Omobole say you didn't do well, it is a backlash on him. You know, a backlash. If the trainer is saying that trainee, no, if the trainer said the trainee is not doing well, it's a backlash on him. So this harbinger of protection does not work with me. If somebody like Zipporah Olani who said this, Maxwell or Yemba, not somebody who is your trainer.
Yes, so did you see me taking notes? In fact, anytime Mahoga Professor Mowale talks, I take notes. So because I've learned a lot from him, and I'm still learning.
You are beyond, your research relationship goes beyond here. So if you don't take note, what? So that's it. So don't worry about that. He's praising you. Meanwhile, he's your trainer. So he cannot train a dunce. He cannot accept that he trained a dunce. So we don't take people like Grace Kia on gender sensitive, people like Omobawale on trainer relationship. We don't take them for real. Before you start taking a bag of rice to him, you know Nigerian factor.
So someone mentioned in the chat board that about local dogs, and I thought maybe we should also mention that. So although I responded by saying that we need more public health awareness. We have a lot of hunters, you know, they keep these local dogs, and they even want them to, some of them even keep cats so that the cats can deal with the rats, and in the process having more leptospirosis if they are infected rats. So we just need more public awareness to go to the hunters, to get to dog owners, either local dogs or any breed of dogs, to tell them about the reality of leptospirosis. And it's more alarming because it's a zoonotic disease. It can affect humans. So we have to ensure that using Blue Bat, of course, which is a very veritable tool in public awareness, to continue to make our voices known and loud that leptospirosis is real. We have to ensure that rodents are controlled, dogs and cats protected, and as such, human beings are protected. I just wanted to put my thought on that.
You know these hunters?
Yes,
these
sir.
hunters and their wild dogs and wild this and wild that, they have, I believe they have different physiology with some of us in terms of immunity, resistance, and if you try to do what they do, you'll die. Are you hearing what I'm saying?
Yes,
and that is
yes.
where environmental physiology, biochemistry, maybe, you know, like I see, we throw teasers for research here. We can't research. We will not research. But we generate topic for researchers. We keep them busy.
Yes,
because
sir.
we are in the field.
Yes, sir.
You know, the close contact between those hunters and those dogs, and even the wild animal, they will kill or they will see dead and collect in the bush. And yet, there's the epidemics of one or two of these diseases are not there. But it is when you, from Savatic cycle, you know, start spilling into the urban cycle, that's when you have problem. So they have to be avoided like anything, because you don't share the same biochemistry, physiology with them. You understand what I'm saying? They have a natural immunity to some of these things because they're in contact with them, they live with them, they are in touch with them. So they don't even need to vaccinate themselves over all those things because naturally they are being vaccinated. Anyway, that's what I think. But even at that, we need to go to them and do more research. Because you see, we are going into the bush to build houses. We're going into, that's why Ebola is erupting from nowhere, from the jungle. They are erupting because people are coming closer to the bush. But the hunters who are in the bush already, and then those who live in the bush already are not having these problems. The way we are having it, you know, it's being spilled into the urban cycle. But anyway, that's the point. Anyway, if we have not, I think if we have exhausted, who is MVMA, please? Somebody is MVMA here. We want to know him or her. Who is MVMA? Unmute yourself, please. Somebody is MVMA having our logo. This is Nigeria Veterinary Medical Association. Adebayo, are you coming for the next conference?
It's still me.
Who?
It's still Agbese using it, sir.
Okay, Agbese, okay, you are the one using it. Okay. Sister Adebayo, are you coming with your husband? Well, we don't see you.
We're working on it. We're working on it.
Okay, please. Oh,
yes, sir. Yes, sir.
I will promise you a lunch with your husband. When
I'll be looking forward to that. Yes, sir.
And my lunch is sweet lunch. Don't worry. Don't worry. Just don't worry about that. Just see, come to me. And one crazy thing about me, I don't recognize faces. So let me tell you, people think I snob. I don't snob. It's age that is dealing with me. I'm older than almost all of 65-year-old man. Why should I be climbing faces and names, combining them together? At age 65. So if you come to me to greet me, I do not greet you the way I suppose. Tell me, oh, I'm Adebayo for now. But don't say Adebayo because we have many Adebayos, like Adeyinka Adebayo, who was military governor of the West. Hey, we have a lot of. Just tell me, hey, let it click. If you discuss first phase, second, I'm not a dunce. I'm not a boxer in Animal Farm where you teach 1, 2, 3. By the time you are teaching 4, 5, 6, you will forget 1, 2, 3. No, don't worry. I'm not that level of age. But there's some element of age in my life now, which I know that I can't help it. Okay. So do we round up and do we say thank you? No, actually, what I really said, Grace Kia or Mobwale said about what you're presenting, which I have even mentioned ab initio, is that you did well. And when we tell people that they did well, we always tell them that they didn't do much, though they did much, so that there will be opportunity for do much. Because human beings are found out. I almost, got to the level of a poor man 2 years ago. But people tell you, oh, you're rich, you're rich. I was carrying with that dystopia. You're rich, rich. I forgot about myself. I saw myself crashing. More especially after my MVMA presidency. Ha! I nearly begged for food. So, but if people had told me you're not rich, you're not, you can see I'll be having the mindset to develop. So get a mindset to develop further. We have not seen the best. We're only today we saw the good of you. We have not seen the better of you.
Yes, sir. Yes, sir. Yes, sir.
We are not spoon feed them. If you have 99%, I say, what's that 1% do? Why didn't you get it? That is me.
Sir.
They said that greet us. I say I won't greet, but inside my mind, I'll be burning with I have intelligent children, but I won't tell you. I say you have 99%, that 1%, or just tell me you came second. Who is that person that came first? He's not a human being.
Yes.
Like they're even taking more snacks from me than the person is taking from the parents. Anyway, that's all. So you don't go. You're better.
Yes, sir.
Okay.
Yes, I will do much more better next time. Yes, sir.
You know, you did better now than
yes,
in blood transfusion. I want your best to come.
Yes, sir.
Oh?
Yes.
And
yes,
your
sir.
best
Thank
should be
you so
highly
much for the
elastic.
opportunity.
Oh?
Thank you
you
so much,
for this wonderful moment to have with us.
Yes. Yes, sir.
So I think we should, what do I say? We will get out. We will run out of the, what do you call it? Out of the YouTube. Well, let me see. It's becoming too difficult. Okay. Stop. Okay. So